Hello, my name is Tyler Holligrove, and this is my head to video. Alright, so knock knock.
Come in.
Hey, my name's Ty. I'm your nurse today. Can I see your wristband real quick? Okay, I'll be right back. I'm gonna wash my hands and provide privacy. I'm gonna wash my hands, provide privacy. Alright. Can I get your name and birthday?
It's April 19th, 1994.
Name?
Devin Wood.
Alright. So, alright, do you know where you are right now?
I'm at the hospital.
Alright, do you know the date?
It's May 21st, 2018.
Alright, and do you know who the president is?
Trump.
Alright, so the patient is alert and orderly type 3, speech is clear. Alright, so her posture is upright, correct, no hunched over. She looks clean, like she just brushed her teeth and had a shower. Now I'm going to assess her neck and her head. So do you have any pain or tenderness?
No, I don't.
Okay, there's no scars, no lesions, no bugs. Her hair's washed. Everything's symmetrical, in place, nothing's missing. All right, and now we're going to perform a head to toe, which I already started. Basically what we're going to do is we're just going to do a run through your whole body, check some cranial nerves real quick, check functions, listen to your heart and your lung sounds.
Okay.
You need to help me do a few things. Besides that, it's going to be really quick and easy.
Okay.
All right, so now I'm going to check your cranial nerve 7, 9, 10, and 12. So with this, I'm going to get you to lift your eyebrows. I'm going to get you to smile. All right, now close your mouth and touch your tongue to each cheek. All right, now puff them up with air. All right, now open up and say ah. All right, any pain or tenderness in there?
No.
All right, so the uvula opens with when you make noises. The tonsils are not touching. It's not red or swollen. All right, now stick your tongue out and go side to side. All right, and then I'm gonna close your mouth real quick. I'm gonna put right here, swallow. All right, no difficulty swallowing. So cranial nerve 7, 9, 10, and 12 are intact. All right, now we're gonna move to cranial nerve 5. All right, now close your eyes real quick. Tell me where you feel me touching you at.
My left cheek, my forehead, my chin, my right cheek.
All right, so cranial nerve 5 is intact. All right, now we're gonna go to 2, 3, 4, and 6. All right, so what we're gonna do is we're gonna look at your eyes. There's no redness, no discharge, no swelling. Do you have any pain or tenderness or itchiness in them?
No.
All right, now what we're going to do is we're going to check your pupil size, which are about a 5, so that's pretty good. All right, now we're going to check to see if they're reactive to light. All right, so that one's reactive. Now now follow my fingers down just with your eyes. All right, so her eyes are pearl. Pupils are equal, round, reactive to light and accommodation. So cranial nerve 2, 3, 4, and 6 are intact, and no problem seeing, correct?
Correct.
All right, now we're gonna go to we had to do cat whiskers. I'm sorry, I've skipped a few. So we do cat whiskers real quick. So follow my fingers just with your eyes. So that one's good. And now we gotta do peripherals. So close your eyes, and then tell me when you see my hand.
I see it.
All right, other one. Tell me when you see my hand.
I see it.
All right, so now cranial 2, 3, 4, and 6 are intact. All right, now we're going to do 8. So, do you have any tenderness in your ears?
No.
They're not red, they're not swollen, they're symmetrical on each side. All right, so now close your eyes. And I'm going to run my finger beside one side and tell me which side you hear it on.
My left side. My right side.
All right, the cranial nerve 8 is intact. Then we're going to go to cranial nerve 1, which is the nose. All right, so there's no discharge, it's not swelling. Everything looks fine in there. Do you have any issues smelling?
No.
All right, keep going. All right, so cranial nerve 1's intact. All right, now let's go to cranial nerve 11. So I'm going to push down on your shoulders while you push up. All right, now push against my hand. All right, push against my hand. All right, cranial nerve 11 is intact. All right, so now we're going to go to the lymph nodes. So you have the submental, the submandibular, the tonsillar, you have the pre-auricular, the post-auricular, the anterior, cervical, the posterior cervical, and then the supraclavicular. All right, now I'm going to check range of motion. So head up, down, side to side. All right, arms up and down. Now give yourself a big hug. All right, rotate your wrists. Wiggle your fingers. All right, lift each hip up off the chair. Okay, bend one leg out. Bend it back in. Now, other leg. Back in. Both legs. Now wiggle your toes. Rotate your ankles. All right. That sounds good. Next, we're going to go to pulses. All right. So we're going to do the carotid. We're going to check one side each time. One there. Then we're going to go to the brachial. Arms out. So the brachial even and present on both sides. Now we're going to go to the radial. The radial are present on both sides. Now we're going to go to the popliteal. Popliteal are present and even on both sides. Now we're going to go to the Achilles. Present and even on both sides. And now the pedis, the pedis, the dorsal pedis. All right, both are even. They're even on both sides. All right, now we're going to go to. We're going to check the skin. The skin looks intact, warm, not cold. No lesions, no edema. Well, I'm going to check her capillary refill, even though I can't see it because she has nails on. So they would be brisk on both sides. All right, her legs, I see no swelling, no lesions. Her skin's warm. No color differential on each side. Again, I can't see her capillary refills because of nail polish, but there would be two with brisk on both sides. Thanks for that. All right, now we're gonna check. We're gonna check her muscle firmness. So they're firm on each side. Leg muscles are firm. Now we're going to check the thorax. All right, so take a deep breath for me. All right, her breath looks like it's even, unlabored, no use of accessory muscles. Now we're going to go, her spine is straight. Okay, turn around. Go turn around. Alright, so, her rhythm is regular. No use of accessory muscles. Her AP to lateral is 1 to 2. Her spine is straight. Do you have any trouble breathing or sort of breath or any pain?
No.
Her skin on her chest and back are both, no lesions, no swelling, no cut. The coloration is all the same. So now we're going to go down and we're going to percuss kidneys to make sure there's and tell me if you feel any tenderness
No.
on either side.
No.
All right, now we're gonna check for tactical firmness, and then say 99 all the way down.
99. 99.
All right, now we're gonna check for thoracic expansion. All right, give me a good deep breath. All right. So that was even. Thumbs expanded and came back. Hang on, computer stopped on me. All right. Now we're gonna check. Now we're gonna do lung sounds. I would listen for one full inhale and exhale cycle every time. We're gonna start here. There. All right, lung sounds are clear and are in all fields. So now we're going to get you to turn back around. Damn, that's 11 minutes already. Goes by fast. Now we're going to listen to the lung sounds on the front. And there we're going to start here. Go over. About there. Alright, lung sounds are in all fields, clear and even on both sides. Alright, now we're going to listen to the heart. We're going to start at the second intercostal space, the right sternum border at the aortic. And we're going to move to the second intercostal space at the left sternum border, and this is the pulmonomic. Then we're going to go down to the third third intercostal space at the left sternum border, and this is Erb's point. Then we're going to go to the fourth intercostal space, and this is at the left sternum border. This is the tricuspis, and then we're going to go to the fifth intercostal space at the mid-curricular line, and this is the mitral. All heart sounds are even and present. All right, now we're going to check balance. Will you hop up for me real quick? All right, so I'm going to get you to walk towards the camera and then turn around and walk back. So her balance is even, her gait's normal. She doesn't lean to one side. All right, now close your eyes, hands at your side. All right, feet together. All right, so her balance is there. She's not, eyes closed. She's not leaning to one side or the other. All right, stick your stick one leg out. All right, bring it back. Stick the other leg out. All right, put it back. So she's a little uneven on one side, but it's not too bad. Her balance is fairly even. All right, now we're going to lay down on the couch. Yeah, put your head down this way. All right. So now I'm going to check for bowels. Have you had any difficulty with bowel movements?
No.
What was our last bowel movement?
Today.
All right. When was your last urination?
Today.
Was it burning? Any pain? Frequency?
No.
All right. Let me move the camera up just a little bit. Let's see. All right. Perfect. All right, now I'm going to watch. All right, so her stomach's even. It's not rounded. It's, fairly flat. The cat's
Did you just say fairly flat?
It's not even. All right, and now I'm going to listen to each side. I'm going to start with the lower right because normally that's where the most vowel sounds are. All right, now I'm going to press her stomach, make sure she has no, do you have any pain or tenderness?
No.
All right, so vowel sounds were heard in all 4 quadrants. No abnormal sounds. Oh my god. Alright, and now we're going to check we already checked her legs, we already checked her capillary refill on her feet. So now we're gonna check her reflexes on her. That's what we gotta go back to. We gotta do reflexes. Alright. We're gonna check her plantar reflexes. Just a little bit to get the feet. Alright, so I'm just going to start from down here on both sides. Relax your feet. Come up and over. Same thing on this one, up and over. Alright, so that's there. Then we're going to check ankle coronalis. So just relax your ankle. Alright, there's reflex. So the reflexes are normal. Alright, now sit back down because we gotta do the reflexes real quick. Alright, so first we're going to start with her tricep reflexes. Relax her like scarecrow. Right here. Alright, now we're to the other side. Alright, those reflexes were even on each side. Now we're going to do her brachial. On that side. Now we're going to do the radial on each side. Alright, now we're going to do her patellar reflexes. And now the Achilles reflexes. Alright, all reflexes are even and present on both sides. And for it wasn't the Achilles, it was the posterior tibia pulses on each side that were instead of the anterior. Alright, and then now, alright, you need anything else?
No, I think I'm good.
Alright, I'm going to leave the call light, and if you need anything, just hit the button. I'm going to wash my hands, and I'm going to document my findings.